like this for the rest of your life? Do you want your heart to feel like this for the rest of your life? If you have any cardiac problems, I suggest that you get this fixed, because you do not want your heart to feel like this for the rest of your life. That's why we have cardiac exercise rehab. What is cardiac exercise rehab? It's specifically made for the client and the client only. It can help them be physically functional. It also can help restore life to them, as that sounds kind of weird. It can help improve their overall health, enable more active lifestyle as well. Cardiac rehab can also support, educate, and change the way a client's life can be and how they eat as well. Some of the benefits that it comes with, the benefits increase the more the patient has a current heart condition. It can help achieve a higher level of independence, also a higher level of confidence as well. It can have a more quality of life. The more you exercise, the more life that you get to live. That's what I've always been told in school. You can become more active and live more of your life as well. Also, but the only thing that does come with this is that exercise has to be part of your daily routine. You cannot just have a bad heart and expect just to do this one day and for the rest of your life you'll be fine. No, you have to continually do it, and you get to see the results as well. Patients can do high intensities for a short amount of time or low intensities for a long period of time, for whatever makes them feel comfortable as well. Cardiac exercise rehab also helps improve their blood pressure, helps reduce the risk of any cardiac disease, and also improves their overall cholesterol levels. Going to the second reason, there's also different workouts and different tests that can be monitored and be tested on with a patient during cardiac exercise rehab. There's two tests that we primarily use. It's one of them is a stationary bike. It's called the Ashton-Ryman test. Basically, the patient just sits on a stationary bike. They go around for 12 minutes. We test their heart rate every minute, blood pressure every 3 minutes, get the results, get the VO2 max. Obviously, they're going to be working at an 85% of their sub-max heart rate. And then we're going to go into the second test that we call the Bruce protocol. They just steadily walking on a treadmill for around the same time, 12 minutes, get the heart rate every 1 minute and the blood pressure every 3 minutes. Once the client has their desired program, obviously it has to be monitored by an exercise physiologist or a qualified professional in our field. And let's go to my partner Travis for more information about cardiac exercise rehab.
Hello class, this is Travis Jones of T&J's Exercise Rehab class. We're here to improve your cardiorespiratory fitness. This is a 6-month program, and in this program we will take measurements of your blood pressure, your body weight, your body mass, and most importantly your VO2 max. And I know you guys may be wondering, what is the VO2 max? Well, the VO2 max is your maximum oxygen uptake, and is measured in incremental exercises, most typically done on a motorized treadmill.
The VO2 max is measured either as an absolute value or a relative value. The absolute is measured in liters of oxygen per minute. The relative value is measured in milliliters of oxygen per kilogram of body weight per minute.
So when it comes to cardio exercise rehab, everybody's body is different. Everyone's heart is different as well. So when it comes to men, women, and children, the hearts are going to react to every exercise that we do as well. When it comes to women, teens and adult females generally exercise at any level of their submax oxygen uptake for around 5 to 10% higher than males. For children, higher heart rates during submax treadmill and cycloergometer activity do not fully compensate for their smaller stroke volume. Cardiac output in men, women, and children have a steady rate during physical activity. So for talking about stroke volume before, how can stroke volume impact cardiac exercise rehab? Well, for example, an endurance athlete's heart has a larger stroke volume at rest and during physical activity compared to an untrained individual of a similar age. For trained and untrained individuals, the greatest stroke volume increases the upright physical activity occurs in the transition from the resting state to the moderate physical activity state, with only minimal further increases. I'm going to kick it to my partner Travis for the last bit of details that you should know about cardiac exercise rehab.
In this class, we will be using both the treadmill and the cycloergometer to measure your VO2 max. Those two tests will consist of the Bruce protocol and the Astron rhyming test, which I will further explain in detail. The Astron rhyming cycle test helps you predict the VO2 max from work intensity and the heart rate using method. The information contained in this package and data which you collect during the submaximal test will allow you to predict the VO2 max for participants between the ages of 15 and 65 years of age. The Bruce protocol is a maximal exercise test where the athlete works to complete exhaustion as the treadmill speed and incline is increased every 3 minutes. The length of time on the treadmill is the test score, and it can be used to estimate the VO2 max value. During the test, heart rate, blood pressure, and ratings of perceived exertion are often also collected.
And as I stated in the beginning, this is a 6-month program class, and we will check your vitals at the beginning and the end of each month, and you will see results based on your fitness level and the standards that me and Joshua set for you.